We address this in the course we teach here. We talk about improvised tourniquets and commercial tourniquets.
Okay.
And can you improvise a tourniquet that's going to work effectively? You can, but it's difficult to do.
Okay.
You have to know exactly. You have to know how to do it. Number one, and the materials have to be available to do it. And by definition, it's what you have laying around. So specifically, so if you're going to improvise a tourniquet, ideally you want to use a flexible material that's about 1 inch wide. You can use something more narrow, but it's not going to be as effective, and you're going to have more of a chance of causing some type of nerve or vascular injury with it. The narrow material is not going to compress the vessels nearly as well as a wider material. So again, statistically, if you look at studies, improvised tourniquets tend to not work very well.
Okay.
But if you had to construct one and make one work, you want something at least 1 inch wide that's flexible. You secure that on the limb above the injury. And then you need some type of mechanical advantage. So you place a windlass, like a rod or a stick or something, through that material, and you twist it, gaining mechanical advantage. And that's going to give you enough compression to stop especially a large arterial bleed. Those guys in that shop had wrapped belts around this guy's arm, but they were just wrapped the belts around, and they weren't getting enough mechanical advantage. So if they had simply, and I talked to them afterwards, I'm like, hey, you guys you started out really well. But here's how you could make that work better. You could have stuck something in that belt and twisted it. It would have worked pretty well.
So that tourniquet has to be tight.
Yes.
Is there ever a worry about it being too tight? Or
well, you tighten it until the bleeding stops.
Okay.
And then it's tight enough.
Like turning off a hose.
Correct.
Okay.
And one of the disadvantage of any type of tourniquet is they're painful. They do hurt.
Oh, I bet.
And so if you have a conscious patient, you got to explain to them, hey, what I'm going to do is going to hurt here. But we have to do this to save your life. So improvising a tourniquet, can it be done? Yes. It's hard. It's difficult to do. So obviously the better answer is having a commercial tourniquet available. And so that's something I've been preaching for a long time, and I've been teaching a version of a TAC med class for 15 years.